Okay, so thanks, everyone for coming along this evening. I appreciate everyone's very busy at the moment, but we're just here, as Ali said, to talk about the ballot and the ballot for industrial action for SAS doctors here in Wales. So we thought it'd be helpful to begin by giving you an overview of how we've reached this point. So health, as I'm sure many of you know, is a devolved matter, and it sits with the Senedd in Cardiff. And our annual pay award is determined by the Welsh Government. And as part of the enhanced pay offer that they gave for the last pay year, so the 2022-23 pay year, the Welsh Government actually agreed to enter into separate medical and dental pay talks immediately for the 23-24 pay year, so the year that we're in. So a lot of work was done by each of the secondary care branch of practices to move into those negotiations, and we did so in good faith, based upon a commitment that the Welsh Government gave to the principle of full pay restoration. But despite that principle being committed to by the Welsh Government, the first and final offer for SAS doctors, for those on the 2008 contract, was a 5% uplift, and for those on the new 2021 contract, it was 1.5% in addition to that multi-year uplift that you'd have already received as part of the transitional contract arrangements. So that was the lowest pay offer in the UK at the time, and was below what the DDRB, so the pay review body that recommends the pay awards for doctors and dentists in the UK, was recommending. And the committee didn't feel that that offer represented a credible first step towards full pay restoration, even though that's what the minister had committed to. And if anything, with it being sub-inflationary, would actually do completely the opposite and would make pay erosion actually worse. And so on that basis, the negotiators decided to reject the offer. And as the Welsh Government had made clear that that was their first and final offer, with no further negotiation on the table, it left the committee with no other option, they felt, other than to move towards balloting for industrial action to try and get a more credible offer from the Welsh Government. So just moving on to sort of what the problem is and why we're sort of fighting for full pay restoration, both here in Wales and across the UK. So if you look at this graph, which is just specifically looking at the SAS doctor pay, you can see since 2008-9, so that's the pay year which started in 2008, SAS doctors have had between a 20.4 and 25.8% cash terms uplift. So that's, what your actual uplifts were each year. That's what the sort of uplifts were. And that difference is just because of the split, as you can see in 21, between, the new and the new 2021 contract and the pre-existing 2008 contract. But neither of these, the pay uplifts haven't kept up with inflation. And what that actually means is for SAS doctors, you've experienced up to 31.7% real terms pay cut against RPI, which is the retail price index, since 2008-9. So, just nearly a third real terms pay cut since 2008-9. The Welsh Government has actually acknowledged the need to restore doctors' pay to 2008 levels. And as I said, they went as far as committing to that pay restoration. But then when it came to that negotiation, that final offer was 5%, as I said, for those on the 2008 contract and 1.5% for those on the 2021 contract. And if, the inflation remains at its current level, that would represent another real terms pay cut at the end of this pay year. So with that in mind, why do we actually need to restore SAS pay? So what's the reason behind restoring SAS pay? So some of the sort of main things are the fact that obviously pay has declined in real terms, and that is in an environment of really high inflation and a cost of living crisis that I'm sure many of you are feeling. And what it's actually leading to is an overall devaluing of the profession. And it means actually that more SAS doctors are looking at retiring, leaving the profession altogether or moving overseas. And it's also making the SAS career pathway a less appealing one for those who might consider a SAS career in the future. So whether that's those moving to the UK to take up that role, or those who are coming to it from having begun their training in Wales. And really, at a time when waiting lists are at an all-time high in Wales, we need to do everything we can to make sure we've got a strong SAS workforce to support the NHS here and to care for patients. So the committee's position and BMA Cymru Wales's position is that we can't go on like this. Doctors, as well as patients, are paying the price for this real terms pay cut. And with the Welsh Government making clear that that offer, which is on the screen, I won't repeat it again, was their final offer, really there's no other option, the committee feels, other than to ballot for industrial action. But the key point behind that is it's not an easy task to go and take a ballot. We need to make sure that we get at least 50% of our membership taking part in the ballot, and the majority of those taking part to vote yes for us to be able to take legal industrial action. And really that's why the committee hasn't yet confirmed a ballot date, because we really do need an emphatic mandate in this dispute. And failing isn't really an option, because, you know, a failed ballot doesn't take us any closer to achieving a credible offer from Welsh Government. So some of you might be wondering, well, what will our ballot look like when it does happen? So only those members who are SAS doctor members and locally employed doctor members who mirror the SAS contract in Wales will be balloted for industrial action. So you have to be a member of the BMA. We've not yet announced when the ballot will actually take part. And as I said, at the moment, the key sort of concern of the committee is making sure that all systems are in place to make the ballot a success. And part of that is making sure that you're really engaged in what's happening, that your contact details are up to date, that you've updated your workplace details so that, you know, you haven't still got a hospital that you worked at 10 years ago as your place of work, because legally we have to have taken all practicable steps to make sure that that's up to date. So that's part of the groundwork that needs to happen. The other point I just wanted to flag at this stage was one of the things that a lot of people are concerned with is international medical graduates, and particularly those working on health and care visas, and whether they can take part in strike action and in the ballot at all. And you know, we completely understand you might have concerns, but just to reiterate, you are entitled as an IMG and as someone who's working on in the UK on a visa to take part in a ballot and to take part in industrial action. But it is important to understand how unpaid and unauthorised leave, which, you know, that's what strike action is, might impact on your visa and what you need to do before and after taking strike action. So we have got extensive guidance that we've worked through for the junior doctors who are, as I'm sure you know, in the process of balloting. And we'll make sure that that guidance is made applicable for SAS doctors when the ballot opens, so that you know exactly what your reporting duties are and what impact it could have, if any, on your visa by taking, you know, a number of days of strike action. The other thing just to flag for IMG colleagues who are on the call is if you have recently moved to the UK, you can join the BMA and receive your first year of membership for free. So there's a little infographic on the page there, but if you visit the BMA website, you can also find more information about that by selecting IMG New to UK on the online join form, which I can see my colleague Georgina has posted in the chat. So just in terms of what you can do as people on the call, what you can do today to help get us ready to ballot. The first, as I said, and most really important thing is go onto the BMA contact details website and just make sure that your postal address and workplace details are correct. So your postal address is really important, because any ballot that we run for industrial action has to go out by post. And if a ballot lands on a doorstep where you don't live anymore and you don't send it back, that counts as an unreturned ballot and goes against us in the turnout figures. Workplace details, again, we have to report to employers the number of people who are taking action at each site and the number of people that we intend to ballot at each site. And we have to have taken as many steps as possible to make sure that that information we give them is right. And you play a part in doing that. The second point then is just rejoining and recruiting people to the BMA. So you need to be a BMA member to participate in the ballot, and really encouraging you and colleagues to do that is really important to actually to get the ballot to be a success. The other thing then is to contact your workplace representative, and we have colleagues on the call today who I know are on the WhatsApp group, but there is a WhatsApp group for SAS doctors that is that's been set up by on the ground reps to have discussions and to answer questions and to really discuss what ballot action, strike action might look like in Wales. So do contact them to join that group. And finally, probably the most important thing is to talk to one another and provide information on pay restoration, because a lot of people might not know what's going on and might want to discuss it. And it's really important to get their views on taking industrial action as well. And just sort of finally, sort of plead to sort of assist in this action. So we've set up a process of becoming pay activists. So we do have, and as you have seen on this call today, representatives who are elected to sit on the SAS committee in Wales. But it takes far more than just elected representatives to make balloting and industrial action a success. And what we actually need to do is create a bigger movement of activists to be able to share our message on the ground to members, to help and be part of the team at the workplace that drives the campaign. So that could be something as simple as being a contact just to put up posters in your workplace, or as big as hosting an event to discuss pay, the ballot and strike action. You'll also be vital on the day of strike action to help organise things like picket lines, to make sure that that's safe, and just making sure that everyone understands what's happening on the day as well. So there's a QR code on screen. It's also available on our website, and you can sign up there to join to become a pay activist, and we'll send you further information then about what's involved. So that's just a little bit of information about the SAS ballot itself. Now, most of you will also be aware that the junior doctor strike action is imminent, hopefully imminent. We've got a ballot currently out with members that's closing on the 18th. And many of you might have questions around what the role of SAS doctors will be during that strike action. So I'll just hand over to my colleague Erica, who's able to give a little bit of detail about that.
Yeah, no problem. Good evening. So the junior doctor ballot closes on the 18th of December, and then the strike action dates will be announced shortly after that. So health boards are already starting to prepare. We have lots of questions via the LNCs. Individual staff members don't have to confirm their intention to strike, so the health board will have to plan on the basis that all of the junior doctors may go on strike, which is where the SAS and the consultant doctors will be brought in to provide cover. Now, the purpose of a strike action is obviously to cause disruption, and the most likely way that the health board are going to cope with this is to cancel elective activity and ask the remaining staff, the SAS and the consultants, to provide cover for the work the junior doctors would ordinarily do. So a lot of ward cover, that kind of thing. So obviously, in order to make the junior strike a success and not to be caused lots of derogations, so that which is when they're called in, we want the strike also to provide safe care. So we are asking that the consultants and SAS doctors support their junior colleagues by providing cover. And I'll go through your obligations on that in relation to your job plans, but also where you can claim additional fees for doing so. So there's various contracts for the SAS doctors. I'll cover the 2008 and the 2021 contracts first, which covers both specialty doctors and associate specialists. So there's acting flexibly and cooperatively to cover absent colleagues is part of your contractual terms and conditions if the request is reasonable, where you are safe and competent and it's practicable to do so. Colleagues isn't defined within your grade, so I think it could include the juniors as well. There's no absolute requirement to provide cover, but your employer can make a reasonable request for you to help cover where the junior doctors are absent. If you do unreasonably refuse, it could potentially result in disciplinary action, although we would do everything we could to avoid that. So what is reasonable will depend on whether the following 4 questions are satisfied. So number 1, is the employer's request reasonable? Is the employer's request of you safe? So do you have the skills to be able to sort of complete those roles? They might be asking you to do jobs that you haven't done for many years that you don't feel that you're competent to do anymore, or that you might need some assistance with, something like that. Are you competent to undertake the request, and is it practicable to do so? For example, you might not be able to cover, you might not be able to change your job plan if you have caring responsibilities or something like that. So there's more guidance on the website about the considerations for all of these questions, and it will to a large extent depend on your individual circumstances. And if you're unclear on where you stand on that, then you are able to contact us and we can sort of talk you through it. Slightly different for pre-2008 associate specialists, of which I know there's still a few. So practitioners in this grade are expected in the normal run of their duties to deputise for absent colleagues in those grades, so as far as practicable. The obligation will depend potentially on how the associate specialists work, for example, whether they share a rota with the consultants or if they share a duty rota with the staff in the training grades. If deputising isn't practicable, then it's up to the health board to provide locum cover. But it's just your job to say that you need it, essentially, but it's their job then to provide it. So as you know, there is the SAS rate card. And so whether that will be applicable will depend to a large extent what you're being asked to do and when you're being asked to do it. So I think just to summarise, if you're providing cover during your normal contracted hours, for which you are already being paid, you couldn't claim the rate card. But if you're providing cover outside of your agreed contracted hours, then this is extra contractual work, and we would recommend that you do sort of negotiate with the health board to provide that additional work at rate card rates. The whole point is disruption. It's very expensive to cover the junior doctors and to support them in their strike action so that they can go on strike safe with the reassurance that the wards and the patients on them are safe. What else can you do to support the juniors? You can donate to the strike fund, which is there to support juniors who have financial hardship and wouldn't otherwise be able to strike. Talk to your junior colleagues that you're working with to reassure them, because I think some people are nervous about the sort of prospect of going on strike, and encouraging them to vote and showing solidarity with them, and you know, explaining that the SAS doctors will also be going down a similar route. On the day of the strike action, you'll be able to visit the picket lines and show support to your colleagues there, and visit any protests that are also around the site, and also provide your support on social media. As John said, this is all about building the movement and showing solidarity throughout the medical workforce. So yeah, I think that covers my bit, and we can answer any specific questions people have about cover if you have them, pop them in the chat. Thank you.
Well, thanks for listening, everyone. So we've just to recap there, we've got a QR code link there that you can scan right now to check your contact details are up to date. So please do that and make sure that your workplace address is right and your postal address. But I will hand back to Ali now, who can look after the question session.